Good morning. Thank you for choosing MedStar Cardiology Associates and only Savali speaking. How may I help you?
Yes, hi. I was trying to find out the price, the cost to have a stress EKG done without insurance. I can get a doctor's order from my family doctor. So,
What type of stress test?
okay, it is a stress EKG and it doesn't involve any other kind of injections or contrast or anything. It's actually...
Because you're kind of mixing two things together. It's either an EKG.
Oh, okay. I'm sorry. It's going to be an exercise EKG. I think it's going to be on a treadmill.
So a treadmill stress test?
Right. A treadmill stress.
Let me check, sir. One moment.
Okay, thank you.
Ways to explore ways of coping, stress of cancer diagnosis and treatment. An oncology social worker can help you learn how to take an active role in your health and well-being. MedStar Montgomery Medical Center is now offering cancer support groups, the second Wednesday of every month from 9:30 to 10:30 a.m. and the fourth Wednesday of every month from 4:30 to 5:30 p.m. For more information, call Deborah Lutani at 301-774-8693. On National Doctors Day and all month long, join us in thanking our doctors for their commitment to quality care and compassion. Every day, our doctors research, diagnose, and treat disease and promote good health for our patients. Join us on March 30th and every day as we thank our doctors for all they do. You can make lifestyle changes to slow down the progression of heart disease. People who quit smoking are more likely to see their symptoms decrease. Be sure to lose weight, avoid alcohol and caffeine, stay physically active, and eat a heart-healthy diet. Lastly, manage stress. Get enough sleep and monitor your blood pressure. For more information on heart failure, make an appointment with one of our...
All right, sir. So you said you have the order from your primary care physician?
I don't have it yet. They wanted me to call and check first. So before they give
If it's for the treadmill, it's $380.
It's $380. Okay, now
Right. If it's for the stress echocardiogram, it's $1085.
$1085. Okay, now if it's just for the without the echo, what kind of results would be sent? Is there an interpretation that's issued, or?
Right. There's a report that comes with the stress echo or the treadmill.
Okay, and that report, is it like computer generated, or would it be done by a doctor? I wasn't sure if any doctor would be involved in the process, or it's just some technician running.
The doctor will sign off on it.
Okay, the doctor would just sign up. Okay, and the final question I had is, that was, I think, my main issue, because I'm on a beta blocker for migraines, so it's not really for any kind of heart condition. So I'm trying to see if it's possible to run the test with the beta blocker, or I'm supposed to get, because the doctor said I should get off the beta blocker. Is that?
I can't answer that question.
Okay.
If you want to consult with one of our cardiologists here, you can, or you can go by what your doctor.
Okay. But the test, if I am on a beta blocker, they can still run it, I guess. I mean, it doesn't stop them from running the test, right?
As far as I know, you are able to take any medications that you are on as you normally do when you do a treadmill or a stress echo.
Okay.
What recommendations your doctor has, that's not my call.
Okay. No, I was just wondering, because what they were saying, is that true, that what I was trying to figure out is if it affects the actual testing? Is that something you need to know?
I don't know. I'm front desk. I can have
okay.
a cardiologist if you would like.
If you could, yeah, if someone could just answer that quick question, because I'm trying to figure out if I'm supposed to get off of it for one day. I think I can get off of it for like one day.
What did your doctor say?
The doctor says that they can probably make some adjustments where I think it's supposed to run according to a maximum heart rate. So I guess your office would have to reduce the heart rate to run the test. I wasn't sure that's how it's done, or it's going to be, because that's what I was trying to figure out, whether it's going to be better not to take it at all at that time, or to take it and have an adjustment made on the heart rate. I think because what they do is they set the maximum heart rate which you're supposed to reach, and I think what I checked on my own, I can kind of reach it with the beta blocker, that maximum heart rate. I don't see what the problem should be really, but I was trying to figure out if they require, if when you run the test, if someone is on a beta blocker, if that's some information you need to have, or is that important? That's okay. Thank you.
Your child almost ready to stay home alone? Our Home Alone class helps prepare 8 to 11-year-olds to spend brief periods of time alone. It will provide them with safety skills when there is no adult supervision, including answering the door, telephone, calling 911, and other helpful tools. To view upcoming dates and times and to register, visit medstarmontgomery.org/classes. Or call 301-774-8881.
Thank you for calling MedStar Montgomery Medical Center. We understand that your time is valuable, and we appreciate you holding. Someone will be with you shortly. Thank you for calling MedStar Montgomery Medical Center. Please stay on the line, and the next available representative will be happy to assist you.
Looking for a safe place to explore ways of coping with the stress of a cancer diagnosis and treatment? An oncology social worker can help you learn how to take an active role in your health and well-being. MedStar Montgomery Medical Center is now offering cancer support groups, the second Wednesday of every month from 9:30 to 10:30 a.m. and the fourth Wednesday of every month from 4:30 to 5:30 p.m. For more information, call Deborah Otani at 301-774-8693. On National Doctors Day and all month long, join us in thanking our doctors for their commitment to quality care and compassion. Every day, our doctors research, diagnose, and treat disease and promote good health for our patients. Join us on March 30th and every day as we thank our doctors for all they do.
Yes, ma'am. Hello?
Hi, yes, 1 second, please.
Okay, no problem. Thank you.
People who quit smoking are more likely to see their symptoms decrease. Be sure to lose weight, avoid alcohol and caffeine, stay physically active, and eat a heart-healthy diet. Lastly, manage stress. Get enough sleep and monitor your blood pressure. For more information on heart failure, make an appointment with one of our cardiologists. Call 301-774-8881. Your child almost ready to stay home alone? Our Home Alone class helps prepare 8 to 11-year-olds to spend brief periods of time alone. It will provide them with safety skills when there is no adult supervision, including answering the door, telephone, calling 911, and other helpful tools. To view upcoming dates and times
Alright, so I asked the tech
Okay.
for the treadmill, and she says that you shouldn't take it that morning because it will affect not being able to increase your heart rate.
Okay, so it's just like just that morning, basically. And then I guess, okay, I think that seems okay. Yeah, so it's like, okay, all right. So
Double check with the doctor who's referring you.
yeah, I will, because that's what they were saying too, that I should check, because what I was trying to see, because what they said is most likely exactly as you found out, that I can't be on it at all, but I was checking if you can make some adjustment on the instrument, whatever, kind of seeing if you can do it some other way. So, okay, so I think this seems to be the best way, just to stay off it. And if I call for an appointment, usually how far out can I get one?
I would say within one to 2 weeks at the most.
Between 1 to 2 weeks, okay. And do you know how long it...
Right now, the first thing I have available would be for Friday, March 27th.
Friday, March 27th, okay. And I guess that thing takes like 1 hour or something?
At the most.
At the most 1 hour. And do you think I can... Okay, and that report you can get right away, because actually it's, you know, it's not really a medical issue. It's with a FAA license issue. So I think the doctor is going to fill out one half of the form. And
right, we would be able to fax that over to your doctor within 24 hours.
okay, and I guess you already asked the other person, but because with the FAA issue, they actually asked for the actual printouts from the test.
They'll print it out and mail it to you, or you can pick it up the next day.
So they can print the actual EKG tracings, right? Not the...
For the treadmill, I'm trying to think, hold on a second. Yeah,
Okay.
For the treadmill, we can actually print it out.
Because they have a list of specifications, like at peak and, you know, this and that. It's like 8 or 9 different points where they need to see the actual tracings. So it's not just a report. So I guess those things, you know, once I discuss it with your doctor down there,